Right now, delighted to welcome Labour's Shadow Health Secretary Jonathan Ashworth to the show. Good morning to you.
Oh, hello. Hi.
Good morning. Come on, just your first reaction actually to this news that this Oxford University AstraZeneca vaccine reported to be 70% effective. Moderna and Pfizer obviously is 95% effective, but we know we've got huge numbers of this vaccine available, and we also know it doesn't require the sort of minus 70-degree dry ice containers to deliver it. What's your reaction to that?
Well, I mean, it's overall good news that we've got another vaccine that in our locker that we can use, and this is a more convenient vaccine to administer. It doesn't have to be kept at these super cool temperatures of minus 70 like the Pfizer one, as you've just said. We've always thought that different vaccines will have different levels of efficacy. What we now need is, with the spending review coming up this week, is a fully resourced plan for our family doctors, for our district nurses, for our health visitors and so on, to get these vaccines out, because the sooner we can get these vaccines rolled out in amongst the population, the sooner we can go back to normal.
Indeed. And we know also we've got 100 million of these vaccines ordered. That's enough for 50 million people. So, I mean, that does give a lot more hope in terms of rolling that out. Certainly rolling out that vaccine, for instance, to the non-vulnerable section of society would make more sense than giving them 90% effective vaccine to those who are more vulnerable or working in care homes or hospitals. But certainly some good, nice to have some good news, because I have to say I'm not that cheered by the supposedly good news of Christmas being saved, as some of the papers are saying today. We are, after the 2nd of December, going to go back into lockdown by another name. Tiers 2 and 3 probably souped up. Who are we kidding? It's tier 4 pretty much around the country. Restaurants and pubs in some parts of the country being allowed to reopen, serving substantial meals only. The shops allowed to reopen and the like. Gyms, places of worship, and probably 5 days over Christmas for up to 4 households to meet. Will the Labour Party be voting for those measures when they come to the House of Commons next week?
Well, we wait and see what Boris Johnson actually announces today. I know it's all trailed in the newspapers, but we still actually want to see the details of it, because, as you say, it looks like the national lockdown is ending, but effectively local lockdowns will continue in many areas, probably across the north. If it's the same ones that were in localised lockdowns before we went into the national lockdown. So we'll want to study the details, but obviously throughout this, we've always been supportive of measures that bring infection rates down. We'll always do what's in the national interest, but let's see what's actually announced, and we'll want to study the details.
Well, indeed. Again, we know that 70 MPs from the Tory side have demanded to see a cost-benefit analysis the government has done about the efficacy of well, they asked for it for lockdowns, didn't get it because we were told by a Cabinet Minister on my show that it hadn't been done. But we were told the reason we had to go into lockdown originally was because the tier system hadn't worked, even though actually we have seen infections going down before the lockdown system could possibly have worked. So it suggests the tier system was working, even though they said it wasn't. But they've now asked to see evidence that this will save more lives than it will cost in the long term. Would the Labour Party expect to see that sort of evidence of government policy being a sensible policy before they go vote for it?
Well, of course, ministers should always publish the evidence, and we should get the briefings from the experts, the briefings from the Chief Medical Officer and the Chief Scientific Advisor. Of course, the government should do that. The government have to be fully transparent. Now, look, I mean, in the end, I probably take a different policy position to some of those Conservative members of Parliament. I think we understand people have different points of view in politics, but I certainly agree that ministers shouldn't sort of treat MPs sort of like children. We should be given all the evidence so we can make our own judgments in the end, and then we can come on programmes like yours and justify the decision.
But you haven't been given all the evidence before, and we know that when there has been some evidence from Vallance and Whitty, actually it's been disproven within hours. In terms of a proper full cost benefit analysis of all of the costs of a lockdown or tiers, as opposed to or the benefits of it, the Labour Party has never actually required that. Would you say, as the Shadow Health Secretary, and surely you've had a conversation with your leader about this, that the Labour Party will not vote for such measures unless or until you see the government's cost benefit analysis?
We're not making our vote dependent on a particular piece of analysis that has to be
You're not
published.
making your vote dependent on knowing the facts?
No, we're not making.
What are you making it dependent on then, out of
No,
interest?
we're not making our vote dependent on a particular piece of analysis. But we know, don't we, in broad terms, that lockdowns bring with them damaging consequences. It's why none of us wanted to see this long lockdown, when we warned the government, unless they acted earlier and with speed, that we would head into a disastrous lockdown, which has huge implications for the economy.
Because your lockdown wouldn't have had huge implications for the economy, right?
Well, no, ours would have been
yours would have been
lockdown.
How long? Well, 2 or 3 weeks is shorter, sharper than 4 weeks.
Well, 2 weeks is certainly shorter than 4 weeks.
You think you'd have had you seriously telling me that after 2 weeks, when it's impossible for any benefit to be seen after 2 weeks, that a Labour lockdown would have finished earlier? What's a load of nonsense, Jonathan?
No, it's not nonsense. Because remember, we would have had a lockdown over the school half term, so you'd have got the benefit of children not being in school. So that would help you bring our numbers down. This lockdown has to be spread over 4 weeks because we all agree children need to be in school. But if you have children in school, that puts upward pressure on your R value. So that is why we said to the government, use the school half term, take the advantage of that period, when then you could have done a 2-week lockdown.
It would never have ended after 2 weeks, and that is so disingenuous to even suggest that.
It would have done. Why wouldn't it have done?
Because you wouldn't have seen any benefit after 2 weeks.
We've just seen a short, sharp lockdown in Wales. We have, and there's still rising numbers in Merthyr Tydfil. Well, okay, look, the key point is there's no evidence, even World Health Organization have said, that these short, sharp lockdowns do anything other than, even the SAGE has admitted, other than delay when people get the virus. And therefore you come out, and then as soon as it goes up again, you have to go lock down again. Well, the problem with the government is they won't rule out this hokey cokey of a third lockdown.
And you won't rule out voting for it.
But we could have avoided lockdowns if we'd had the testing system and the tracing system in a better place. I mean, that is the tool to have gone back to having a reasonable level of normal life until you get a vaccine. And we've never had that.
All right.
We've never had this testing and tracing system fixed. It's been a shambles. And you know what? It's cost £12 billion of your listeners' money.
I'm fully in agreement on that. Although the interesting thing is, of course, is Germany had a very effective testing and tracing system, and they've gone into lockdown again. So maybe that wasn't the answer. Who knows? But I agree with you on the incompetence on that front. I know you've got to go. The TUC has hinted at a strike threat over the public sector pay freeze that's going to be announced by Rishi Sunak, the Chancellor, on Wednesday. One of your colleagues, Lucy Powell, yesterday said this was a kick in the teeth for public sector workers. Do you really think that it is reasonable for public sector workers, and the NHS is excluded from this pay freeze, by the way, should get a pay rise when millions and millions of people in the public sector have been on either no pay, 60, 70, 80% of pay, been on furlough, lost their jobs, poised to lose their jobs, haven't got a chance in a month of Sundays of getting a pay rise in the next few years? Do you really think it's a kick in the teeth for public sector workers to keep their jobs, keep their job security, but not get a pay rise?
Oh, yeah, it is a kick in the teeth for our hard-working public sector workers. Of course, they deserve a pay rise.
Why?
Because our teachers keep our schools open.
Do their job. Yes. That's what they're paid to do already.
Street cleaners keep our communities clean. Of course they deserve a pay rise. I think.
Well, wait a second. Why don't public sector workers deserve a pay rise? Private sector workers, why don't they?
And they've had, by the way, years and years of pay restraint.
So is the private sector.
The pay cap was lifted a couple of years ago after about 7 or 8 years of pay freezes.
And do you think the private sector, all those years of austerity, were just paying themselves an extra 100% a year?
And now Rishi Sunak wants to balance the books, having spent billions and billions and billions and building up the deficit on the backs of public sector workers. I think it's deeply, deeply unfair. Do you think that we should subsidise, for instance, a pay rise for all these supermarket workers and delivery drivers and those working in those Amazon warehouses? Those people were the people keeping us afloat just as much as the public sector workers during the lockdowns. Yeah, and the public sector workers spend their money in those supermarkets, and they spend their money at Amazon.
Yeah,
that's how the economy works. And
in that case, why don't we give them 100% pay rise, and then they can spend that money, then everything will be fine.
If you have freeze public sector pay, it has wider implications for the economy. So I don't think it makes economic sense to freeze public sector pay in the way in which it's been. But although we don't actually know, because this is just what's being briefed to newspapers, we'll have to wait and see till Wednesday as to what's actually happening.
I just want to clarify that there's going to be a massive effect on the economy of 4 million public sector workers not getting a couple of % pay rise. But you're not that bothered about most of the private sector being shut down for a month at a time. That's okay. You'll vote for that.
Well, I am bothered. I am bothered about it. I didn't want to see it. It's why we warned the government.
That's why you voted for it.
It's why back in
You
the summer,
voted for it, Jonathan.
It's why back in the summer
You
we said to the
voted
government,
for it.
if you don't fix testing and tracing, you're going to be in a mess.
You
and they
voted
didn't fix
for
testing
it.
and tracing.
You voted for it.
And I did vote for it, yes, but I didn't want to. I didn't want
Well,
us to
who
be
made you
put
vote
into
for
a
it then?
4-week lockdown. Because I looked at the level of the infection rates in our hospital and our hospital admissions, and I thought we had no other option.
But you were
Because when I listened to NHS leaders warning about what was happening in their hospitals and asking us to do that, I thought that was the responsible thing to do. But nobody wanted to be in a situation where we have to impose a second lockdown on the British people, and we certainly don't want to see a third lockdown. So we need reassurance from the government that they have a plan to avoid a third lockdown.
Okay, which the Labour Party will happily vote for.
Not happily.
Let's 100 quid to charity. Wherever the next lockdown is announced, you and the rest of the Labour front bench will happily vote for another lockdown. Without seeing any evidence that it'll work. You will vote for it, won't you?
If that is what is proposed,
yep.
We will consider it. We'll consider the details. We'll consider the infection rates.
You didn't consider the details last time. You didn't demand to see a cost-benefit analysis.
We did. I mean,
no, you didn't.
We did consider the details.
No, you didn't. There was no cost-benefit analysis published. You couldn't have considered the details.
A cost-benefit analysis is the one piece of detail that you need now to vote on something. Do you not look at a wider basket of analysis?
That is the wider basket of analysis.
You don't listen to what the NHS leaders are telling you. You don't listen to what the CMO is telling you. You don't listen what.
Well, last time we listened to the CMO and the CSA, they told us we'd have 4,000 deaths a day by now.
You don't listen to independent epidemiological advice. You
Yes,
don't listen to the wider concerns.
Yeah, and they will provide you with the cost-benefit analysis.
But you just
tell you that lockdowns don't work.
We need this particular cost-benefit. Who produces this cost-benefit analysis, which is like the sort of the gold standard for you? Who is it?
The officials. Well, normally ends up being the officials in the Treasury
and the government.
But you don't believe
the officials.
No. That's why you get to test the analysis. You can see their arguments for what is the cost and what is the benefit of a particular policy. When you know that. And then you can look at the detail of what they are claiming, and you can challenge the detail, and then you have an idea of the detail. But
and what's in this cost-benefit analysis?
The wider cost to society of there being a lockdown, which is that you're going to have more deaths long term from a lockdown than you're going to save, which is now well proven and well documented around the world.
But we know that.
But you still vote for a lockdown.
A piece of analysis.
Well, but why do you keep voting for a lockdown that's going to cost more lives than it will save?
Because it's not going to cost. Because you've got to save lives, and you've got to save your NHS from being overwhelmed.
It wasn't overwhelmed the first time round. It wasn't going to be overwhelmed this time round.
You've got NHS leaders, people who are running hospitals, saying that our beds are filling up, our ICU beds are filling up. We are getting overwhelmed here.
They weren't overwhelmed. No. I'm sorry.
Okay then. But the NHS leadership are telling me that. But,
if they're telling you that, I can tell you.
So you don't believe them now?
No, I don't, because I can tell you I saw an internal analysis by very, very senior, a very, very epic document, the NHS, showing that they had no expectation of being overwhelmed whatsoever.
So the NHS leadership is lying when they say to the country, our hospitals are going to be overwhelmed?
Yes.
Okay. Well,
I'll send you the document. I'll email it to you after the show. You can have a look at it. Okay. I know you've got to go. You had to go about 5 minutes ago, but we'll leave it there. Jonathan, always love to talk to you. Jonathan Ashworth, Labour's Shadow Health Secretary.